There is a new crisis hitting Ontario's hospitals, and it's affecting the tiniest of patients. Ontario's opioid epidemic means there's more babies being born with addictions requiring intensive care, and that is putting a huge strain on hospital resources.
And while she held him, she sang, "I'll love you forever."
Caring for your typical premature baby, as seen here, no pint-sized problem. Now specialists say the opioid epidemic means it may be time to rewrite the book on how hospitals treat its youngest addicts.
I would say by the year 2000, most of the babies needing attention in Ontario and Canadian hospitals were from opioid exposure.
Dr. Brian Chisamore helped create the Toronto Centre for Substance Abuse and Pregnancy program at St. Joseph's Hospital about 20 years ago. He's now working from a handful of centres that are caring for the hundreds of babies born in Ontario each year with some form of addiction.
We have the mothers that are on prescribed opioid replacements like methadone and buprenorphine, and then mothers who are on opioids as well too.
Neonatal abstinence syndrome is a condition where an infant is born with symptoms of drug addiction and withdrawal after being exposed to drugs in utero. A recent study done by the Canadian Institute for Health Information shows there has been a 27% increase in babies born with NAS over a 4-year period, jumping from 1,450 cases in 2012 to 1,850 in 2017. More than half of these cases are in Ontario.
Their cost is probably tens of thousands of dollars a baby.
The challenge, the average length of stay for a newborn in the NICU is about 8 to 9 days. Those with withdrawals can stay 10 times that, at anywhere from 15 to 60 days. And with NICUs like the one here at St. Joseph's Hospital already struggling with resources, Dr. Chisamore says it may be time to rethink where these babies are treated.
Maybe it comes out of the NICU. Maybe it becomes more pediatric wards. Maybe we teach the mothers how to withdraw how to wean their babies from morphine at home.
Because the one thing science shows is that keeping mom and baby together means better outcomes for all. So you're saying kind of where we're standing right now, and if the rate keeps going, we're running out of space.
We will need to look for space to keep these mothers in the hospital the requisite time we need, and yes, it might need to be outside of the NICU.
And that study also found that across the country, opioid poisonings resulted in an average of 16 hospitalizations a day from 2016 to 2017. That's up about 19% from 2 years before.